All right, everyone. Thank you so much for tuning in to Medicaid Work Requirements Part 2. If you are here after seeing Part 1, welcome back. If you have not yet seen Part 1, we do a deeper dive on the proposed rule and on the One Big Beautiful Bill or OB3 or HR1 or whatever you want to call it. We will go ahead and drop that link in the chat for the YouTube recorded version of that one. But that one is really essential to get a little bit more of the background in what is going on with the proposed rule and how that bill came to be. Next slide, please. So really quickly, I just want to run through the agenda. We're going to do a quick welcome and introduction, and then we're going to do a short recap on the proposed rule. Again, the deep dive was in Part 1. I also wanted to bring the community perspective from Brittany Malcolm. She is a sickle cell disease warrior and just an overall incredible person, and has an incredible story and insight into what all of this means. Lastly, we will wrap up. We will talk about some advocacy we have done on our end, on the back end and the front end, give you some resources to activate and do advocacy on your own and within your community, leave some time for questions and concerns and feedback, of course, and then give you a couple more ways to engage. Next slide, please. So first and foremost, my name is Alyssa Davenport. I'm the Director of State Policy and Advocacy at Six Cells. I've been in this role for about 2 months, and it is so incredible to be here alongside you all. We really hit the ground running with all of this going on, and I'm really happy to be able to be part of this process. Also presenting with me is the incredible Ryan Hill, who is the CEO and founder of Indigo Hill Strategies. She's just our eloquent and wonderful lobbyist, and she really helps make sure everything gets across the finish line. Next slide, please. So I will go ahead and pass it over to Ryan, who is very in the weeds on CMS's proposed rule, and she can give a quick recap on what's going on and what is at.
Thank you so much. Thanks, Alyssa. And as always, thank you for the kind words. It is truly an honor to be able to represent Six Cells before the federal government via the administration, regulatory bodies, and Congress. And so this rule is really an extension of all of that work because it involves so many different parts of the federal government. So next slide, please. So I'm going to do a quick recap for those of you who are just joining us or who want a refresher on the proposed rule. If you are with us in Part 1, as Alyssa mentioned, we've covered that rule in a lot of detail. So I'm going to move through this at a quicker pace than I did on the first webinar for the sake of time, because we have a really great agenda before us. So before we get into this quick recap, I want to do a bit on where this rule actually comes from, because it's not something that the Center for Medicare and Medicare Services, or CMS, came up with on their own. Back on July 4th of 2025, as Alyssa mentioned, we got a really big bill called HR1, the One Big Beautiful Bill Act, signed into law. That law told CMS that it had to create a bunch of different things, including work requirements for Medicaid. And this rule that we're about to walk through is CMS following through on that instruction from HR1, or the One Big Beautiful Bill. So here's what the rule actually says. If you're a non-pregnant adult on Medicaid between the ages of 19 and 64, you will now, starting when the rule is effective, you will now have to show that you're doing at least 80 hours of work a month, volunteer, and that's working, volunteering, going to school, or something similar to what CMS will call a qualifying activity. If you're applying for Medicaid for the first time, you'll need to already be meeting that requirement for at least 1 month before you apply. If you're already on Medicaid, you'll need to show that you're meeting it by the time your coverage comes up for its annual renewal. And this isn't just off in the distance as we went into on the first webinar when we talked a lot about the effective dates. The rule is taking to effect July 31 of this year. So just in what, like 16 or so days from now. Um, every state has to have it fully up and running by January 1 of 2027. So states do have a little bit of a runway in terms of how they're figuring out how they're going to implement the rule that is fully effective July 31. And that difference is important. That difference in dates is important because states often can only do what the federal government allows them to do from a Medicaid perspective. And so that's why you see that difference. So while the rule goes into effect on July 31, states have until January 1 of 2027 to really make sure that all of the things that they're required to do are in place so that they can officially start by that date. Next slide, please. Now, on the work requirement, not everyone has to meet this requirement. The proposed rule lays out exemptions for people who fall into what is called a medical frailty category. There are five of them listed on this slide here: blindness or disability, substance use disorder, a disabling mental health disorder, a physical, intellectual, or developmental disability that limits daily activities, or a serious or complex medical condition. These five categories come straight from HR 1, that one big beautiful bill, as it's called, again, passed last summer. So states aren't allowed to necessarily tweak those categories based on what is in HR 1. But here's the part that I really want to make sure that we are highlighting again today. The rule lays out exemptions for people who fall into what's called a medical frailty category, right? And that's what we talked about earlier. It's not enough to just have one of these conditions for in some states. You also have to show that this condition significantly limits your ability to actually go out and meet that 80-hour work requirement. That's a tougher standard than a lot of states and advocacy groups were expecting. A lot of what we had been lobbying on Congress and the administration. It does mean, though, that having that qualifying condition alone may not automatically get that exemption. So the rule is going to give states a wide latitude as to how they can define those categories. So we expect individual state interpretations to vary, but these are the set categories. Next slide, please. So what does this mean for the sickle cell disease community, for warriors? As you guys may know, and I think we talked about this in our first webinar, sickle cell disease is not specifically named in the rule as a qualifying disease. That doesn't mean that warriors are necessarily left out. It means that sickle cell disease would likely need to fit under one of those five categories, right, that we talked about on the slide before. So whether or not sickle cell disease actually make the list, whether or not a warrior's case is found to significantly limit their ability to work, is going to depend on the state and the individual's documentation. So for right now, through January 1, right, 2028, warriors can self-attest, meaning that you can state your condition yourself without needing paperwork on hand right away. After that date, the self-attestation is allowed one time at initial enrollment. Every renewal after that will need documentation. And again, we're expecting additional guidance on this to come out shortly. So the advice here is that this is something that Six Cells is watching really closely. We're engaging with states and the federal government to talk more about what this self-attestation means. And then we are making sure that we're able to communicate that to warriors and to the sickle cell disease community as the information becomes available to us. And I think I'm going to pass it over back to Alyssa.
Excellent. Thank you so much for that. I'm honored to introduce Brittany Malcolm for a community perspective on how this will impact her and also give some insight into how it will impact the community. So if we could go to the next slide, I will go ahead and pass it over to Brittany. You'll see that she is a jack of all trades, incredibly accomplished, and really just overall a great testimony.
Hi, my name is Tisha. My name is Brittany Malcolm. I'm a sickle cell warrior. I have a I'm also a construction manager as well as a civil engineer. So I have a Bachelor of Science in Civil Engineering Technology. I have an associate's degree in construction management. I'm a certified construction worker, manager, and apprentice. I also have a license in foam installation, and I also have a license in quick tie. And I'm also a traveling hairstylist. So through all of those, sickle cell has been right there. But as I'm going through getting those degrees, going through school, trying to work, it has been a challenge to achieve all those goals. Two things that I do well, three things do want to talk about is like when I was in school for my bachelor's for the engineering, going to school, trying to work as well, trying to work 40 hours and trying to get that and as we would say, normal to society, what society says is normal. I ended up having to stay 2 years extra in school because of my sickle cell, and I did 7 classes one semester, and that did not work for me. I ended up having acute chest syndrome, the flu, pneumonia, and I ended up in ICU. I went on a ventilator on the Christmas Eve of 2014, and I ended up getting off of the ventilator in 2015 after New Year's. Oh, and I also had blood clots in both my lungs at that same time as well. So that was a very challenging time. Then I had to turn around and go back to school and try to finish that. So I spent a lot of time in the hospital and trying to catch up, trying to get my studies together. It is very challenging to do that and try to make those requirements to say work 80 hours a week. I have no way of saying, okay, I can do that all the time. I may can do it sometimes I can't. With sickle cell, you never know. It can change from 1 minute to I don't know if I'm gonna feel good the next minute or the next hour. I can't make any promises. And then the second thing I want to talk about is trying to work when I was in school and actually have working at I was actually at McDonald's, I think it was, and working all those hours trying to make a living. I ended up spending, I think it's like September 2009. And I ended up spending about majority of that month in and out of the hospital. I only think like 2 weeks I was out of the hospital of trying to work. And during that time, I end up learning that their job and your managers, they tell you, hey, I understand. I understand you're sick. I understand that. But then on the other hand, you get the bias of it being a warrior, and you get the side conversations. They never said anything to me personally, to me, but those side conversation was like, okay, there's always a problem. You're always sick. I always got to find someone to cover for you. Most of the time they feel like you're not there, you're not reliable. To them you become a liability to as more than an asset to them, and that's a problem. It's truly a bias out there of you get a more understanding when they're talking about like cancer things they can actually see. You get more of, I say, passage, well, not really passage, but more of a understanding because they can see the changes. With sickle cell you can't always see the changes, you can't always see the pain. There's just a lot out there, and I really do not think that as a warrior that I will be able to provide that to keep my insurance. And that's something I really, really need. Because how am I going to pay for medication? How am I going to get have to pay for my hospital stays? All those things now, if I'm required to do that and I know I can't on a daily basis to get this requirement, how am I going to survive? How am I going to be, as they say, normal? What society says is normal. And that's really a concern as a warrior in trying to figure that out. So hopefully, as we go on, that we can actually get this out of the way and I have more security. It's really about having some security too as a warrior. I know my disability. I know when I have that disability, I have my insurance, I can get my medication on time. I can get to my doctors on time. I can get the fluids I need. I can get the pain medicine I need or whatever is needed to me to actually survive. Without the insurance, how am I going to do that? And that's really truly a concern. And that's maybe what I have to say.
Thank you so much, Brittany. Thank you for sharing that. One of the things that I think is really impactful about your story as well is that you talk about your experience in school as well as working, which is something that is relevant with these work requirements and shows how both facets of it could be impacted. So thank you so much for everything.
Yes, ma'am.
Next slide, please. So in continuing on talking about the community perspective, we heard from Brittany, and this is one perspective from one person in one state. And although we identify that sickle cell disease can have some commonalities, each experience is unique in its own way. We also know that over 50% of sickle cell disease warriors are enrolled with Medicaid. So this policy is positioned to have an impact on the community. When you advocate alongside your community, it's rewarding, it's uplifting, it's impactful, and no action is too small. So some items you can do yourself to help raise the voice of the community is, first and foremost, submit your own public comment letter on this proposed rule, which we'll get into in the next couple of slides. Once this comment has been crafted, please share this comment and your concerns about this rule far and wide. Share it with your members of Congress, but also share it with your local leaders, your local state representatives and state senators, and especially your state Medicaid office. Believe it or not, they do want to hear from you. They really do want to help, and they want to make the program work. Lastly, and of course, please stay engaged and informed with 6Ls on how to best navigate any proposed changes. We are here for you, and we want to equip you with everything you need. Next slide, please. So let's talk a little bit about some advocacy. So how do we submit a comment letter? This is something we touched on in the last webinar as well, but I want to reiterate the importance of doing this on both an individual level and on behalf of an organization or an entity. So first and foremost, you'll search for the rule at regulations.gov and press comment. You'll prepare your public comment by writing a clear and concise comment that includes your story, how this rule will impact you, and what you'd like to see changed into the comment box. You'll fill out your required information, such as contact information, who you are submitting on behalf of, etc. And then you'll review and submit it. And then congratulations, you have activated advocacy. We also have created a toolkit that we will provide that walks you through it step by step. We have screenshots and arrows and everything to make sure that it is as clear as possible. Next slide, please. So what are we doing as an organization on the front end and on the back end? So 6Ls has led efforts to relaunch the Bipartisan Sickle Cell Disease Caucus in Congress, and we are currently working with caucus lead staff to do more member recruitment. We actually had a meeting this week talking about potential members and recruitment strategies, and the future is looking bright for that. Regularly, we are also engaging in state Medicaid office outreach on the individual state level. We're also assisting both Sickle Cell Disease Caucus co-leads on planning their first briefing, which we are tentatively planning for September. So please stay tuned for that. We're also in the process of planning an event during the Congressional Black Caucus Annual Legislative Conference this September. So September will be a busy month for advocacy. And then lastly, I want to talk about our 2026 6Ls Coverage and Therapeutic Summit, which is a collaborative forum to discuss the changing landscapes of healthcare and coverage for sickle cell disease. This essentially is an opportunity to hear directly from the clinical trial participants and their reflections on the experience. You'll hear from industry on drug and therapy pipelines. The opportunity will be presented to participate in trials, and we will discuss the policy environment that may impact the policy and regulation on therapeutics. Essentially, this meeting brings together the insurers, the providers, the pharmaceutical companies, the patients, the caregivers, the researchers, the care teams, the policymakers, and any other advocates in the community in one fell swoop to discuss what the landscape looks like, what's next, and how we can fit into that. Next slide, please. So with that, I will pass it to you all if you have any questions, concerns, or feedback. I know this is a lot of information and a lot of guidelines. There will be an email coming afterwards with the toolkits. The other thing I wanted to highlight is that Six Cells has authored our own letter to go to CMS, and we have also authored a letter to have CBO sign on and participation. We've circulated that, and I will be recirculating it again. Please consider adding your name or your organization, I'm sorry, to our CBO sign-on letter. We really want to amplify the voice and show that we are unified in our concerns for this proposed rule. So with that, now I will actually turn it over for questions.
We have a few hands raised. Alyssa, if you'd like to check those first. We have Kwaku.
Oh, perfect.
Yeah, hi. Thank you very much for the presentation. I just wanted to ask, is July 31st the deadline only for CMS's proposed rule, or is it the deadline for the comment period generally?
That is the deadline for the comment period. So we'll have to submit it by July 31.
Okay. Thank you.
Thank you.
And Marverine.
Oh, wow. Hello. Got my name right off the bat. Maureen. Most people don't. They use Maureen. So thank you. And just a quick story. My mother was the ultimate negotiator. She had six sisters-in-laws. They wanted Maureen. She wanted Marva, so she combined it and made it Maureen. And so thank you. My name is Dr. Maureen Beverly. I'm currently president and founder of Maureen Beverly MD PLLC, Patient Engagement and Cultural Competence. And over the course of time, when I was in the hospitals, I'm from New York, I developed the first sickle cell support group for adults as they transition from adolescence to adult. And because the treatment was just, unimaginable. The pain is unimaginable, and also the bias towards patients when they're in such severe pain. And so it was a result of a patient that I decided to form the first sickle cell support group, and also to write my book, 9 Simple Solutions to Achieve Health Equity, a guide for healthcare professionals and patients. And it's on Amazon, but it's her story that led me to develop the sickle cell. And I went in to see her, and everybody said she was attitudinal, disrespectful, always in the emergency room, drug seeking. And I'm saying, what 18-year-old is not attitudinal without a life-threatening condition? Let's give her the benefit of the doubt. And I won't expand, don't want to take too much time. But I'll never forget, Monday morning, 9 o'clock, I was about to enter her room, and she went like this. I'm on my phone. And the team is saying, that's what we're talking about. When she got off her phone, I'm about to enter her room. And she said, if you have a cure for my disease, come in. If you don't, and she pointed, keep walking. And I became the child, and she became the adult. And why do I say that? She said, did you hear what I said? I'm going to repeat myself one more time. Isn't that what we tell our children when they're not following direction? I said, I don't have a cure, but I'll come back and see you. I went back to see her at 5 o'clock. Who she was in the morning was who the system created. Who she was in the evening was the actual human being. Mm-hmm. Yeah, I'm saying, I don't want to go on. But anyway, I said, just tell me about your family. And she said, she was 18. Her mom got off the bus, developed chest pain from work, taken to a hospital, and died of a heart attack. At 17, her sister got admitted for sickle cell crisis and sepsis and died. And she was now 18, and she lived with her uncle. And she said another powerful statement, which is embedded in my brain. You doctors don't teach me about sickle cell. Sickle cell teaches me. And it's because of her why we created a first sickle cell support group. But I would like to know, I would like to share to see whether it would be interested, sickle cell patient experience form. which the whole idea of the form is to change the hospital system from health disparity to sustainable health equity on patients with sickle cell disease. So Alicia, or I don't know who else, if there was a time that we could discuss, and there's a pharmaceutical company that's actually interested right now in the form, because it would be done nationally. And that's the way we could change the way patients are treated. And the ultimate goal, if we get data collected, then that data will go to Joint Commission. And if Joint Commission tells hospital what to do, who's going to say no? But anyway, thanks for listening. And I would really like to discuss it, or maybe it's a possibility that I could, the next time you have a meeting, I could share the form, I could discuss it. But thank you. And Brittany, thank you so much for your story. It touched my heart because I totally saw so many patients with your story, and your tenacity and who you are. Never give up, okay, on yourself. And also, we're here to help. Thank you.
Yes, ma'am.
Thank you, Dr. Beverly. Oh, go ahead, Brittany. I'm sorry.
Oh no, I was saying yes, ma'am. I thank you so much. I try my best. But that anyone that I can talk to and get the story out so they can understand better, I have no problem doing that.
I just don't mean to I just want to ask about the Medicaid. Would that apply to children, newborns, or kids that are in, babies or children that they don't have Medicaid?
Is Ryan still on?
Yeah, Dr. Beverly, are you asking if if what we discussed today would apply to to children? Is that what you're
No.
asking?
The topic of Medicaid, whether or not
Yeah.
people that they're saying, so it's people with sickle cell and may not get Medicaid except if they have certain of the criteria, disabilities and so forth. But in terms of the policy on Medicaid, would that apply to kids, babies, children,
No, so children are covered through the state children's health insurance programs, which is also sort of falls under Medicaid and CHIP.
Yeah.
So the Medicaid requirements would only be for adults,
Okay.
and not for children.
Yeah. Because in New York City, there are 9 public hospitals. You don't need insurance to get care in New York City. In the public hospitals there. Thank you. Appreciate it.
Thank you. And Dr. Beverly, 3 things. One, I think we met a couple weeks back, either at Howard or NIH. I can't remember, but we met in passing, and so it's great to see you again. Second, thank you for sharing the story. Don't ever apologize for taking up too much time in talking about stories. I think that that's what's important, is to humanize these experiences so that it's very real what the implications are on very real people. So thank you for sharing those stories about patients and about family. And third, I would love to touch base. I will reach out to you after this, and we can talk some more.
Great. Appreciate it. Would love to. Thank you.
Thank you. Okay, I see another question in the chat. I'm going to loop Ryan in for this one as well. It's, how can advocates help ensure states apply exemptions consistently without creating additional administrative burdens or coverage gaps? Oh, thank you, Dr. Beverly. Ryan, can I call on you for this one?
Yeah, absolutely. So this is part of why we try to encourage the community to really engage with federal and state agencies as they're thinking about how to effectuate some of these the changes that are coming down the pipeline. And Paul, I think the question is a really good one, because we all need to make sure that states aren't increasing the burdens on warriors and their caregivers and community-based organizations. The broader conversation around HR1 and the One Big Beautiful Bill, or OB3, and the potential cuts to Medicaid, which you may have heard, are all around this concept of administrative burden. And so we can anticipate that, again, this is beyond the sickle cell community, but we can anticipate that the vast majority of individuals who will lose their Medicaid, again, this is a separate conversation, the work requirements, excuse me, will be because of an increased administrative burden. And that is, as you know, but just for the edification of the rest of the group, is filing documents, finding documents, submitting documents, dealing with the state Medicaid agencies. A lot of folks may have moved, right? There are all these different administrative issues that could and are predicted to lead to losses in coverage or coverage gaps. And then what that means is that when people don't have health insurance, as you guys know well, their health state becomes much more tenuous because they may not be receiving care or seeking care in the way that they traditionally would should they have health insurance. We also could imagine that people may not even know that they are in a coverage gap, right? That they may not even know that they've lost their coverage because of the administrative burdens. When you're thinking about how to engage with the states, as we mentioned, states have the next 6 or so months, less than 6 months now, to figure out how to implement these work requirements, excuse me, coming from the One Big Beautiful Bill Act and all the things that are in the proposed rule, which again, the due date that's effective July 31. We are, as I mentioned earlier, watching the state space really closely. We are consistently engaging with state Medicaid officials and helping them to understand sort of what needs to happen. What is the ideal state from a sickle cell warrior, caregiver, community-based organization perspective? This is where I would really encourage you guys to stay close to what Six Cells is doing here, because we'll have many opportunities to bring you guys along as we are helping states to think about, again, the administrative burden or coverage gaps, but also we'll be able to share information as it comes out and sharing state opportunities to engage. I would imagine, and I don't know this for sure, but I know that because different states have different process for making big policy changes like this, it's very likely that you may have states that will do a quick a comment letter process of their own. Some states may have roundtables where they're engaging with the community. There are all these different opportunities. And so I would stay close to Six Cells on this, but I think it's something that is going to be really important as we're thinking about what does January 1 of 2027 look like, and how do we as advocates make sure that states understand our perspective, what our issues are. And again, that's part of the reason why the comment letter period is going to be so important. Alyssa, anything I missed?
No, no, that was extremely thorough. Thank you for that.
Yeah, of course.
So I don't see any more questions, and that actually leads good to our final slide. If we could go to the next slide, please, which is how to stay engaged with us. First of all, please subscribe to our monthly newsletter. We talk about events and policy and really keep you up to date with what's going on in the general landscape of the community. Additionally, love for you to follow us on social media. We are getting more and more active, and we're promoting, our webinars, different spotlights, really trying to keep the voices amplified in this time. And then, of course, email us with questions or comments at any time. engage@sixcells.org, and keep your eye out for a follow-up email. It will include 2 toolkits, the toolkit for the how to submit a comment letter and an FAQ. Additionally, I will be sending out an email for CBO sign-ons. We have set an internal deadline. The deadline to submit all comments is the 31st. The deadline to sign on to Six Cells comment is the end of this week, 7/17, I believe. That's in 2 days. Yes. So please consider signing on to that. We're a very united front when we are, and this is going to be impactful. And this is a very unique and special disease state and community. And we really want to make sure that this is prioritized within CMS on the state level and within formulary. Thank you so much.